Hello everyone, I am Sanskriti. In this module, let us learn about the hypersensitivity reactions. Hypersensitivity is an immune response that causes diseases. Generally, it is an exaggerated or inappropriate immune response. All hypersensitivity disorders follow a similar pattern. The first contact with an antigen sensitizes a patient to that antigen. This generates an immune response. It may involve antibodies. It may also involve memory cells. The second contact with the antigen results in the hypersensitivity reaction and patients develop symptoms from an overreaction of the immune response. The specific immune system reactions are broken down into four distinct patterns and they are called the type 1, type 2, type 3 and type 4 hypersensitivity disorders. We'll start by talking about the type 1 hypersensitivity reactions and these are what most people call allergies. These are immediate immune system reactions to antigens that occurs within minutes. Some of the common triggers of type 1 reactions are things like pollen, pet dander, and peanuts. The reason these occur is because there are preformed Ig antibodies inside the body from primary exposure, and these antibodies are bound to mast cells and then the antigen binds and cross-links the Ig antibodies. As a result, the mast cell degranulates and releases its contents into the tissues, what causes the symptoms. IgE antibodies. Susceptible individuals make IgE antibodies to antigens where other people do not. The majority of people instead make IgG antibodies and they do not have hypersensitivity response. The IgE that is synthesized in the susceptible individuals come from B cell class switching. This is driven by Th2 T helper response, which is a part of humoral response. A key cytokine is IL-4. IL-4 triggers the B cells to class switch and produce IgE, and it's very important in type 1 hypersensitivity reactions. IgE does not activate complement and the complement system is not important component of the type 1 reactions. So, what are the symptoms of a type 1 hypersensitivity reactions? Well, it depends on organ system you're talking about. In the skin, type 1 reactions manifest as urticaria or hives, and the respiratory tract people get runny nose, which is rhinitis, where they can develop wheezing. Asthma is one of the type of hypersensitivity reaction. In the eyes, patients can develop conjunctivitis. Their eyes will become itchy and red and watery. And then in GIT, they can develop diarrhea. Anaphylaxis is an example of a systemic type 1 hypersensitivity reaction. Patients who get anaphylaxis develop itching and diffuse hives and erythema. They will develop respiratory distress from bronchoconstriction. They can develop hoarseness of voice because their larynx will swell and become edematous. They can also get GI symptoms like vomiting, cramps, and diarrhea, and this can lead to shock and death. The treatment of choice for anaphylaxis is epinephrine. It will vasoconstrict to raise the blood pressure, it will dilate the bronchioles, and it will help relieve many symptoms. Patients who have a history of anaphylaxis often carry what's called an EpiPen around with them so that they can administer epinephrine to themselves if they develop one of these reactions. Some examples of type 1 hypersensitivity reactions. Well, asthma is a classic one. In asthma, patients' mast cells degranulate in response to allergens and they develop wheezing and shortness of breath. Some benefits penicillin drug allergies are type 1 reactions, especially patients who get urticaria or hives after receiving penicillin. Some seasonal allergies are caused by type 1 hypersensitivity reactions. These are often referred to as allergic rhinitis. Allergic conjunctivitis is a type 1 reaction, so is a peanut allergy, which many children have, and also a shellfish allergy, which many people have as a food allergy. Mediators of type 1 reactions. One of the most important is histamine. It leads to vasodilation, which causes warmth of the skin. It also leads to increased permeability of venules, causing swelling, in addition to smooth muscle contraction. This can lead to bronchospasm. Other important mediators are derived from arachidonic acid. These include leukotrienes, prostaglandins, etc. They can be produced quickly as a part of early phase, and they can also be produced later as a part of late phase. I've listed some of the prostaglandins and leukotrienes on this table on the slide that I think are most relevant. One of the most important is PGE2. This is responsible for many signs and symptoms that we associate with hypersensitivity and inflammation. For example, it causes redness and vasodilation. It can lead to edema by increasing vascular permeability. It can raise temperature in the hypothalamus that causes fever and can also sensitize nerves, and that's what causes pain. PGB2 leads to bronchoconstriction and eosinophilic infiltration into the sites of reaction. Leukotriene C4 and D4 causes vasoconstriction and bronchoconstriction, and then finally leukotriene B4 has been shown to draw in neutrophils and eosinophils to sites of inflammation and type 1 hypersensitivity reactions. Some of the other type 1 mediators are ECFA, stands for eosinophil chemotactic factor of anaphylaxis. It is preformed in mast cells and it attracts eosinophils, which are often involved in allergic reactions. Serotonin can also be released by mast cells that causes vasodilation. Platelet activating factor is a substance that causes bronchoconstriction. And then finally, there are proteases called neutral proteases like chymes and tryptase that are released by mast cells, and these can dissolve proteins. Heparin is also released by mast cells, which, as you know, is an anticoagulant. Allergy testing for the presence of IgE antibodies is sometimes done to see if a person is sensitized to a particular substance. This is done by administering a small amount of allergen either by pinprick or puncture to the skin or by an intradermal injection, and a positive response is formation of a wheal, which is a raised integrated red area of skin where the antigen was injected. Many patients are desensitized to a particular allergen if they are life-threatening or really necessary for a person. For example, people with heart problems who are allergic to aspirin are desensitized to it so that aspirin is administered without the risk of hypersensitivity. Moving ahead, let's talk about the type 2's hypersensitivity reaction, and these are autoimmune disorders where antibodies attack our own cells or tissues. In type 2 hypersensitivity reactions, antibodies like IgG and IgM are directed against our own tissue antigens. They bind to and cause damage of normal structures in the body. There are three mechanisms by which these antibodies cause tissue and cell damage. This can be through phagocytosis, through complement-mediated lysis, or through antibody-dependent cytotoxicity. In some of these disorders, antibodies bind to cells and those cells are consumed by phagocytosis. Phagocytes like macrophages will recognize either the Fc receptors and the IgG antibodies or C3b from the complement pathway. Damage can also occur to cells and tissues through complement. IgM or IgG can trigger the classical complement cascade. They can form the MAC and this can lead to cell death. And then finally, in these disorders, there is often antibody-dependent cell-mediated cytotoxicity. This is where natural killer cells bind to Fc portion of IgG and then release their contents and destroy cells and tissues. Rheumatic fever is the classic example of a type 2 hypersensitivity disorder. In rheumatic fever, strep antibodies cross-react with cardiac myocytes. This can lead to myocardial damage and damage to the heart walls. Another classic example is exposure to the wrong blood type. If you are exposed to the wrong blood type, you may have lysis of RBC. This is what causes erythroblastosis fetalis when Rh negative mothers have Rh positive babies. Another example is autoimmune hemolytic anemia. In this case, antibodies bind to and destroy red blood cells. Other examples are Mycoplasma pneumonia, pemphigus vulgaris, which is a skin disease where antibodies are directed against desmosomes in the epidermis. Good-Pasteur syndrome. This is a condition where patients develop the nephritic syndrome and pulmonary hemorrhage, and it's caused by antibodies against type 4 collagen. And finally, myasthenia gravis is an example of type 2 hypersensitivity reaction. In this case, they are antibodies against acetylcholine receptors, and all these disorders share the common theme of antibodies directed against tissues or cells in our own bodies. Type 3 hypersensitivity disorders. These disorders occur when antigen and antibody complex is formed usually with IgG. These complex systems form activate complement, and these leads to tissue and cell damage. Then, what's the difference between type 2 and type 3? Well, the difference is that in type 2, antibodies directly attacks the tissue or the cells. In type 3, they bind to small antigens and then they deposit in the tissues as a complex of an antigen-antibody together, and that leads to the disease. There are two subtypes of type 3 reactions. The first subtype is called a serum sickness and the second subtype is called an Arthus reaction. Let's talk about the serum sickness form of a type 3 hypersensitivity reaction. In this form of disease, there are immune complexes, which are those antibody-antigen complexes circulating in the bloodstream, and they deposit in lots of places causing systemic disease. The antibodies are usually IgG or IgM, and these are good complement activators, and you can just imagine those complexes circulating all through the body and depositing in skin and kidneys and joint and triggering systemic diseases. Once they are deposited, they trigger immune responses from complement activation, and in addition, they activate macrophages and neutrophils via their Fc receptors, which serve to bind to these cells. A long time ago, doctors would take horse plasma or horse serum from horses that had been exposed to diphtheria and scarlet fever, and they would administer the serum to human beings in an attempt to passively immunize them against those infections. What they saw is about 5 to 10 days later, the people who received the horse serum would develop a classic triad of fever, rash, and arthritis. What was happening is the patients were serum antigens and immune complexes of horse antigens and antibodies were depositing in the skin and joints of the patients to show the classic triad of symptoms. So, patients who have a classic serum sickness type 3 reaction can get urticaria and palpable purpurea. They often have no serum complement levels because these immune complexes consume the complement proteins. They will have an elevated sedimentation rate from inflammation. They can develop diffusion. They can also have acute glomerulonephritis from deposition of immune complexes in the kidneys. A classic serum sickness is very rare in the modern era. There are only a couple instances where you may see something like this. For example, people who are administered rabies or tetanus antitoxin sometimes experience a serum sickness. Rarely penicillin can cause this reaction. And then finally, certain monoclonal antibody therapies like rituximab and infliximab have been reported to cause serum sickness like illnesses presumably by binding to antigens and depositing in the tissues. The Arthus reaction is the other type of type 3 hypersensitivity reaction. It is also caused by antigen-antibody complexes. However, the complexes don't circulate in the plasma and deposit in tissue, instead form within tissues where they cause disease. This is a local reaction, not systemic, like serum sickness. It's usually in the skin. What happens is when you inject some antigen and then preformed antibodies in plasma or tissue will bind the antigen and form immune complexes locally right in the skin where you directed the antigen. The Arthus reaction is named after Dr. Arthus. The Arthus reaction usually takes about 4 to 10 hours after injection. It's much faster than the 5 to 10 days for serum sickness because the antibodies are already present, and contrast to this with type 1 skin reactions which occur within minutes. For these reactions, it takes a few hours for the immune complexes to bind. Once they bind, they lead to complement activation and edema and necrosis. So let us see some clinical examples of Arthur's reaction. If you administer a tetanus booster to a patient or a diphtheria booster or a hepatitis B booster, you are administering antigens into the skin of somebody who has been previously exposed. They may have circulating antibodies that can deposit and bind to the antigen at the site, and this will cause swelling and redness at the site a few hours after injection. This is also being reported with people who have diabetes and have to repeatedly administer insulin under the skin. Let us move on to the last and the final type of hypersensitivity reaction, that is the type 4, which is also called as the delayed type hypersensitivity reaction, and in contrast to all the other types, this is entirely cell-mediated and does not involve any antibodies at all, which makes it very different from types 1, 2 and 3. This is a memory T cell response to an antigen. The classic example of a type 4 hypersensitivity reaction is PPD test for tuberculosis. A couple of diseases that are good examples of type 4 hypersensitivity are contact dermatitis, which includes poison ivy. This happens when chemicals like plant oils attach to your skin cells and then CD8 T cells recognize those oils and attack the skin cells. This leads to erythema and itching. And as you know, if you have ever had poison ivy, it doesn't occur immediately. It occurs the next day or the night after. It takes about 12 to 48 hours for this delayed type hypersensitivity reaction to occur. Another disorder that's believed to be a type 4 hypersensitivity reaction is multiple sclerosis. The pathogenesis of this disease is poorly understood, but it's believed that type 4 hypersensitivity reactions to mild and basic protein are one of the mechanisms that lead to demyelination and causes neurologic symptoms. And that concludes our module on hypersensitivity reactions. Thank you.